Okay, welcome. Waiting for the stream to start. Welcome everyone to another Chinese medicine chat live stream. Hope you're doing well. I am hopefully getting better at doing this each time we do it. So questions are welcome. It usually takes a few minutes for people to realise the stream is happening, so I'll let people jump into the chat and do that. We're just going to double check the audio levels. It looks good to me from this angle, from here where I am. I'm just going to double check that. So we've got questions. I've got a few little questions to answer from just catching up on the other questions. Yeah, but you're welcome to ask any kind of related things. I've got to find my channel. Let's have a look. This is the things you have to do when you start it yourself. Here we go. Let's check it's all right. This is the things you have to do when you start it yourself. Okay, great. Perfect. Yeah, look, I still don't trust the level. Sometimes you see the little thing and you're like, is it working or not working? So, yeah, well, welcome to 2025. If you haven't jumped on a stream this year, I've done quite a few to find the right time for people. And this is the time of the year, I think, where people kind of either feel guilty that they never started a health goal or any kind of goal, their New Year's resolution, or I think it's like the 21st or something. That is the typical time where people drop off, 21st of January. So if that's you, don't feel bad. Like, that there's never a better time to start than right now. Like, right the time when you think you're going to start on these things. If you've got things that you want to, health goals you want to achieve, or things you're trying to do, right? So you've just got to start somewhere, and hopefully this stream will give some people some motivation for that if they have that. Oh, good, we've got questions coming in straight away. Right, okay. That's a big topic there. I just remembered how I was going to do this for this time. What were we doing? Right, okay, now I know what I'm doing to get these things. All right. So Amir the Great, what a great name. That's awesome. I'll just have to pop this in here. So I'm going to answer your question in a sec. So you've got a question about desire, sexual desire. So I hope this doesn't flag the stream as something untoward, but this channel is completely medical health related. So it's not, it's not supposed. It's if anyone from YouTube's listening, they kind of think it. It's not an OnlyFans or anything like that. And that's not what I think the person's intent was, but I just see that happening with a lot of, people saying these kinds of questions. I don't want the chat to be shut. The chat to be shut down. I don't want that, but I don't want the stream to be shut down either. So yeah, look, there's stuff we can talk about for here, definitely. All right, here we go. There's the question. So Amir the Great says, hi there, thank you for helping. Can you tell me what I can do for impotence and low sexual desire? So we can do different things. Well, there's different ways of approaching it in Chinese medicine, and this is one of the areas of Chinese herbal medicine that is completely exploited, particularly for males' sexual health. It's completely exploited in terms of these kind of potions and lotions and pills and like internal treatments like herbs and things like that, deer penis and all these kinds of like things that are sold to boost desire, boost, I don't know how they'll just have weird names for it that they kind of say, boost sexuality, I guess, or whatever. And look, some of that stuff, there can be a little bit of correctness in the concept, but it's actually not how Chinese medicine kind of approaches it. So I'll give you kind of how a Chinese medicine practitioner might approach that, and then maybe some stuff you could try to do for yourself. Now, what's going to work for you depends on your diagnosis, and that's where so I'll give you the general things that can go wrong, and then you might have to sort of work that out, puzzle that out for yourself a little bit, or work with a practitioner to kind of get the diagnosis and then see whether you can do the treatment, right? So the wood element in Chinese medicine is responsible for men's sexual health. Like wood generates literally wood with like that concept. So you might have heard me on this because I'm going to try to keep this as much as I can to things you can try for yourself, things you can do. So if you went to see a practitioner, they're going to cut right through the mustard, cut right through all the stuff to try to get to the issue and hopefully give you the herbs and the treatment or the acupuncture that's going to, it'll be a lot more simpler, I guess, than all these different things that I'm going to give you that maybe you could try. And there's probably other people listening that have a similar kind of a thing. So a lot of this stuff is due to a low function of that wood element energy that you might see in other areas of your life as well. So not necessarily, again, like this, if I was seeing a patient, I might sort of maybe ask them some of these questions to see if that's the case. Like I might say to them, do you feel like your motivation's low in other areas, not just in that area? And they might say, yeah, actually, it isn't great. Or I've had some patients that they're like, no, I'm really fine, everything's great in those areas. So if it's not great, then it might be stuckness or stagnation of the wood energy. In Chinese medicine, TCM, they kind of think of that as liver qi stagnation. So exercise, moving, stretching, like singing, laughing, those kinds of things all just have a moving, stagnant energy effect. One of the main herbs that's used now, I'm reluctant to say these things because I don't want people to go home or go in your home, go into your cupboard and then get this out and think, oh, this will give me the best, sexual function ever, because it doesn't work like this. We would never use this one herb just by itself. And also, in order to get the functionality from it, you'd have to take quite a lot of it, and it's most probably, if not highly likely, that the one you have in your cupboard at home will not be the same as there's different species of it. And the herb I'm talking about is cinnamon. So cinnamon is one of the main herbs. It's never used by itself. It's used in cahoots with a whole bunch of other herbs in a formula to kind of do that. But its function is kind of that stimulation of that wood element, right? It's kind of moving moving that drive, moving that force. And then what does that do in the 5 elements? So wood generates fire. So we have 5 elements: wood, fire, earth, metal, and water. And fire is what is related to desire. So if there's a lack of desire, right? So desire, and like I don't want this stream to be flagged too much. Hopefully, it's kind of a, I don't know. I'll just have to answer it how best as I can, and it's as hopefully, because if I beat around the bush with it, people won't even understand what I'm trying to say, and I'll probably say something wrong anyway. So being able to get an erection and being able to maintain an erection are 2 different kinds of things that can happen. But some people have no desire or a low desire, and if they don't have that much difficulty getting an erection or maintaining erection. So those 2 things can be different. They don't always go hand in hand. So yeah, they're things you sort of discuss with your practitioner to kind of get the idea. So I'll keep talking about this question, but people are welcome to ask questions. And yeah, if you're jumping in the chat, let me know where you're tuning in from, what side of the world you're in. Yeah, mate, that's a good word to use. See, I've never been struck with this question before, male vitality. Otherwise we'll have to stop and start the stream again. Yeah, so desire, right? Let's talk about that. So that is like relate to the fire element. And And the fire element is relating to pleasure, and it also relates to love. So that need that we want to be loved and have love and that kind of stuff, and that the pleasure aspect of love, that's a fire element. Whereas the aspects of a relationship, building a relationship with someone, those things are different elements. Maybe the earth element a bit more. So definitely you need wood to generate that. So that's like getting the spark, getting the interest, like being interested in it. And for some people that can be, so I'm assuming it's for a male, but for a female it's also the same, right? Wood generates that, wood generates fire. So definitely that's a more of an issue for men, in terms of like there could be, it's not always, but there can be prostate problems, there could be issues with urination, and in that case then there's often things that we would do to tonify the kidney energy, which is the precursor to the wood element. So a big part of traditional Chinese medicine when they think of men's or any kind of fertility or what was the word that male vitality they always stick that with the kidney. Why do they do that? Why they say the kidney governs those areas. So in TCM they say that the kidneys govern reproduction. So like the ability for you to make the elements of conception. And that's kind of where TCM kind of leaves it. When you kind of unpack it a bit more, you can see that there's other aspects involved in that. But that is often if someone's very tired, like you'd know that kidney energy or that water element energy is depleted because you'd have a big aspect of tiredness. And that's probably the difference between the two. Like you can't really be kidney deficient, let's say, or water element deficient, Shao Yin kind of deficiency. You can't have that unless you're going to be super tired. So you'd have no energy to do anything. You wouldn't be doing any exercise. You'd just be like tired. And of course you'd have no motivation because water isn't generating wood, and then that means there's less to generate the fire, which is the desire, right? Whereas if it's just stuckness of the wood element, because the wood element doesn't really get that, it can get depleted, and that would be more blood deficiency, but that more happens to females, not so much to males. So what would happen with the wood element often is you'd get stagnation, which would be a person that does exercise and they feel a bit better. They might not do a lot of exercise, but if they were to go to the gym or they were to do a walk, they would still feel some benefit, and they wouldn't be like needing to lie down in the day. So hopefully that kind of differentiates the two different aspects. But yeah, don't get caught up on some kind of website or something kind of buying all these random hocus pocusy kind of Chinese medicine things. So how do you find a real TCM doctor? That's a good question. So there's 2 or 3 people in the UK. One of the guys that I'd mostly recommend is one of my teachers that's there, Laurie Ayres. He did a podcast episode with me when he was here, actually came here to Perth. And so you can see, you could check out that episode. It was about yin deficiency, but if you just want to sort of see who that person is. And then there's other practitioners so he's in London. There's other practitioners in London. There's not that many that are outside of, I'll put his name in the chat. I'll just put that there. You can just kind of look that up somehow. If you get stuck, send me, actually go onto the podcast episode with him on there. It was pretty recently. It was about, when was it? July last year, something like that I did that. And then I think his details for his clinic are actually in the description of that. So if you really get stuck, just send me an email to my Chinese medicine podcast at gmail.com and I'll send you the details. Awesome. Hey, Character Matters. I love that name. I've said that before. If you have a question, please feel free to ask it. Yeah, so then this question is, thank you, I'll find for sure. I swear most of them touch the pulse and make stuff up. Yeah. um, he doesn't touch the pulse and make stuff up. He is one of my pulse diagnosis teachers, and he's very, very good. But yeah, sometimes, I mean, pulse diagnosis is really hard to do. And I remember when I first learned Chinese medicine, this is going back 23 probably. I was thinking about that today. Someone asked me how long have I been doing this for. So, I mean, it's easy to work out, actually. I just realised that because I graduated in the year 2000. So this will be my 24 years I've been doing it, right? I remember at least the first 3 years doing that. I never made things up to the patient, but I would be feeling the pulse and not be sure what I was feeling. And I would have to go do the diagnosis by the symptoms and rather than the pulse. But yeah, it's easy to sort of, sometimes it's not that practitioners are making it up, but it just sometimes also can just sound a bit too mystical and a bit too woo-woo. And they're just like, you know, I knew even some of my teachers would just feel the pulse and they'd be like, oh, very, very not very. One of my teachers used to say that about acupuncture needles. She'd be like, "Oh, very danger" or "very safety," and she didn't speak that great of English. I mean, that's not great English to say that way either. But anyway, yeah. So if other people have a question, please put your question in the comments. But yeah, if you can spend a lot of money in this area in this topic, sort of with these tonic kinds of foods. Now, one thing that definitely can help if it's stuck energy, and you'd know that because you wouldn't be the sort of person who needs to lie down and you wouldn't feel that sleepy and tired a lot. But if come back to that one, but if you're not like that and you kind of, you know, feel generally good with doing exercise, but there's a bit of like lack of motivation, then you could maybe get some benefit out of watching the wood element personality type thing that I did, because it's not about, it's also that personality type or that character is part of the wood element itself. Things that help liver chi, which is the wood element, is singing, laughing, exercise, pungent foods, right? So cinnamon belongs to the pungent foods, but things like coriander, ginger, garlic, mint, basil, like these things are kind of moving and spreading, and they kind of really help to generate freeness, release stuckness is probably the best way to put it. Release that stagnation. Cool. So yeah, that's probably for that question. All right, Jemima's got a question. Let me have a look. This is a great one. Yep, just takes me a second to put these questions on the screen. Oops. So it's a diet related question about eating a calorie, not like calorie deficit, but then it not working very well. So this is a really good one, and it's also common, right? This is the one of the main ways people try to lose weight, and you're told to lose weight doing this, right? So Jemima says, I've been eating a calorie deficit consistently for a period of months, but I find that I haven't been losing any weight. Would there be a TCM reason behind this? So possibly, if you were a patient of mine, I would then feel your pulse, ask you some questions, see if there's a pattern of disharmony there. So, okay, I'll offer you a few options what it could be, right? If your body's got a major disharmony there, especially in your digestive system, or what's then affecting, because whatever affects your digestive system affects your hormones. And we don't talk about hormones much in Chinese medicine because they're never mentioned. Like, it's never mentioned in the Neijing. It's never, does it mean that they didn't know about them? Maybe, but they were kind of observed their functionality through the dysfunction that happened in our body, but they didn't ever say, oh, that's your thyroid or that's this. So those dysfunctions of hormonal things, which is what's often a key part of losing weight or good metabolism and things like that. Sometimes when you stop eating certain foods, your body can't make the hormones that it needs out of what you're giving it, what's left, what's eating there. And just because you reduce the amount of food that's there, doesn't necessarily mean that your body flips that switch to go, oh, let me scoop up the residue. Now it will do that technically, and this would be starvation, right? So if you're in a place of starvation, I'm not suggesting you do this whatsoever, but like, it will do that. But essentially, if you were in that, you'd be in a state of ketosis anyway, because you wouldn't be eating, if people are fasting, for instance, or not eating much. So, so your TCM pattern of disharmony could mean that a certain diet is better for you, and then maybe that's the thing you're cutting out. So in order to reduce the calories, you might have cut out, protein, and then your body might not be having enough fat or enough protein to make the stuff that you need out of it. So another part of another TCM kind of answer, or Chinese medicine kind of answer, can be that how we think about your metabolism and everything being healthy in that way is the earth element, so your spleen and stomach. So particularly if it's lots of raw food, which I find lots of people do on diets. It could be shakes or raw food, liquidy kinds of foods. That in itself can just overstrain the spleen and stomach more. So lots of cold and raw fruits, juicing, that kind of stuff. So if it's that, then definitely kind of, because your question's a good one, but it's a very broad one, so there could be lots of reasons there. If a person's blood deficient, they need either lots of nourishment of blood by herbs, or a decent amount of meat and collagen building stuff in their body, like bone broth, or at least a decent amount of meat in their diet. So if they're vegetarian or vegan and you're blood deficient and you go on a calorie deficit kind of a diet, that could be part of it. I mean, there's other reasons you could think about depending on what are you left with in the diet, that is there sugar in your diet at all? Even if it's less sugar than you had, you're going to have insulin pumping around in your body. So there's a concept. This isn't a Chinese medicine concept, but I often use this with my patients to kind of make it easy for them to kind of think about it. Any carbohydrate or sugar that you eat literally flips a switch in your body. It's a switch that's like, okay, insulin has to be released. So insulin has to go into your bloodstream and has to be released in your body to break down the carbohydrates, which is going to turn into sugar, to basically break down that sugar. And when you're not having that, then the light switch goes off. And so when insulin isn't pumping around in your body, then you're in a state of what they call ketosis. And that's a keto diet. So if you've ever heard of that, so if you were doing a calorie deficit, but you're also doing a keto diet, I would be struggling to work out why. Maybe if it's a keto diet, you just need more fat, because that's a big part of that kind of a diet. There's thousands and millions of diets that people can follow. Another way to kind of help you self-diagnose a core kind of functional deficiency is on your abdomen, right? So I'll just sort of sit up. I'm on a sort of standing stool here. So that's where my navel is. So just below your belly button. Sorry, I'll speak into the microphone. You won't be able to hear me. Just below your belly button. When you lie, so just lie down flat, and do this when you're not sort of like just finished exercising or something. You don't want to be all sweaty and hot. And you just kind of feel on your abdomen where's cold and where's hot. And if that area down there is cooler, and it'll just feel significantly like, oh, that's a bit weird. It doesn't feel cold to you. It just feels cooler when you touch on it. That's often, that's one of the ways in Chinese medicine that we diagnose like a deficiency. Like that's a yang deficiency kind of symptom. That's not the only thing we use. Like obviously pulse diagnosis is used, but if I'm consulting with people by Zoom, I can't obviously feel their pulse. I'll often ask them to feel that area to sort of see what that's like. Now, if that's the case, then any diet you do, whether you calorie restrict yourself or not, you should not have cold foods. You should not have raw foods, or very, very little. And you should try and have moister foods, not too many dry foods. So crackers and, drying kind of things. Yeah. So yeah, look, it's a complicated scenario, and I would encourage you highly to sort of look into a keto kind of a diet if you really want to lose weight and you don't want to feel hungry. That's kind of a good way to do it. All right. Any other questions? Oh, that's all right. Don't be sorry it was broad. It's hard with these things because I want to answer people's questions, but I also don't want people to give out too much information because it's your private information, right? Which is important. And I'm sure you don't want to give out too much private information either. So yeah, I'll just kind of I don't want people to feel like, oh, you're judging me or something. That's not what so it's just kind of like, it could be this, it could be that. Yeah. So these are kind of things you can kind of do for yourself. All right. Anyone else got a question that they want to ask? Bit of a quieter one tonight. Stream. Yeah, so I guess you can kind of with those kind of diet things, you could some Chinese medicine practitioners will give you a specific diet. There's not that many. It's getting less and less common for Chinese medicine diet therapy or dietetics to even be taught in universities and schools. It's if it is taught, it's kind of a part of it, a little bit part of it, but it's not a big part of people's practice. But there are practitioners I've seen, because I've sometimes you Google people or you find people online that they do sort of have a special interest in it, or they kind of really just focus in on that, and they're good at that, and they can kind of maybe tailor you a Chinese medicine based diet. But it's kind of beyond the scope of practice for most Chinese medicine practitioners, unless they've been trained in nutrition or something else specifically, to sort of give people a plan like, okay, if you eat these meals a day, you're going to lose weight doing this. That's kind of it's not really how we approach diet therapy. It's more to treat okay, you've got a sore throat, here's a pear that helps dryness, or you've got this kind of constitution, these are foods that would help you, or foods to avoid. And they're very broad things, and then it's up to you to do the portion control. It's up to you to kind of work out how you do all that. That's kind of where the majority of Chinese diet therapy kind of sits. Yeah. All right. So if there's any other questions, people can ask them. Could be about anything, really. Any Chinese medicine things. I mean, I can try and answer other questions, not about Chinese medicine. I've got some questions here from other people that I was going to get to today. Just from my normal my list. I've had so many weeks of not doing any videos or streams, so there's quite a few things to get through here. So I have this question. I'll probably, let me do this one. Someone asked me a question about hair loss in pregnancy and birth. So I'll answer that if there aren't any other ones on the thing now. So basically, hair nourishment comes from blood, right? So when you're pregnant, your body's going to give all of its energy, all of its resource, all of its goodness to the fetus, to the baby, in preference over the mother, right? And there's kind of a bit of a concept of here we go. Let's put this on here. Wonder if people will be able to see this. Let's see if they can. I don't even know if I can see this. It's such a small little thing. Hi Marie, what causes hair loss after pregnancy and birth? Will this happen to every woman, and can anything be done to stop it from happening? And this was asked on recently as a question on one of the videos from my hair loss. Well, not that recently, it's 4 months ago, but I didn't answer it. I just realised that sometimes I scroll through the questions, scroll through things in the back end of the YouTube thing that they give you, and then I'm like, oh, how did I miss that? I didn't even see that like at the beginning. So, Radiant Fanatic, yes, awesome to join. Welcome. You're welcome to ask any questions you want to ask. We're just answering this one here about hair loss. This is a pretty easy answer, really. So when you're pregnant, your body's, it's in a state of needing a lot of resource. Blood in Chinese medicine is a big one. And like if someone's so blood deficient, they won't be able to get pregnant. Like you'd have to, like quite extremely blood deficient. But you see this with athletes that like their cycle goes on hold. They won't be able to get a period. And that's part of that amenorrhea process, where your body's like, okay, we're just struggling keeping you going with what you're doing right now. It wouldn't be possible for us to have, like, the body to have the resource to keep you going at the rate that you're doing whatever you're doing and make a baby. So the cycle just stops. That's a part of life. So what happens is when you're pregnant, your body's consuming that resource, and if for some people they already had a pre-existing blood deficiency and they kind of got pregnant, and it's a good sign if you get pregnant. You must be healthy enough to get pregnant, but then maybe some people get a meat aversion even when they're pregnant. They can't eat that much meat, or they had some complications or something like that, or they're older. Like you get pregnant when you're 25 versus you're pregnant when you're 38. Like there's a big difference there. So I can't say every woman's going to get hair loss or hair falling out, but what that is a sign of is that your body, all its resources kind of been given to this baby at your expense. So how you would prevent that is as much meat nourishment as you can. And if you don't have meat, like things like blackberries, blueberries, raspberries, beetroot, lots of warm cooked foods, lots of that kind of nourishment and then if on top of that or as part of that, like foods that nourish the spleen and stomach, like would help. So you kind of want that. Now, if you ever have heard of this thing called the month of confinement, right? I'll write that in the chat. It's called month of confinement. And it's quite a strange little journey. There's only a few videos I've seen of people, these Chinese couples, showing what they do and what they eat, right? Because it's if you follow it strictly, there's very specific meals that should be eaten after you give birth. And it's like literally the food is so rich, but it's like as in rich with dense meat kind of rich foods, and sweet foods like puddings and things like this that are like gelatin, like this. There's this donkey hide gelatin, urgao sort of jelly like dish that they have, and it's like this idea of like, okay, you've had the baby. It's nothing to do with your hair falling out, but just to sort of nourish your body after that, so that there's plenty of resource there for you to breastfeed and do whatever. But you also are protecting your body in that month of confinement against colds and flus by not having, like, you're not even talking of aircon, I'm going to put mine off because it's getting cold in here, but you're not supposed to have the aircon on. You're not supposed to shower certain days, or very rarely should you shower. You shouldn't have your hair wet, like, for a whole month. So it's quite an involved process, right? And it's about keeping the pores closed or not vulnerable to wind and cold kind of getting in you. You're not supposed to have people over to your house. In China, what will happen is the mother-in-law will come and cook, and so there's a lot of concern for women after they've had a baby to kind of like, hey, we've got to really look after this person. And we don't do that in the West. We just say, oh, you've had a baby, off you go back to work whenever you're ready, like, like you've had a baby, like, you're bringing it out after a week, taking it down the shops. And it's not about the baby as much as it is. I mean, the baby's vulnerable, but the mother is like super vulnerable. So all that sort of stuff can definitely help people to prevent detriment on the mother, on themselves, after pregnancy and birth. So during that, now there are herbs that we kind of use to kind of support the like trimesters. In general, with acupuncture and Chinese herbs, if there's nothing wrong with you in the pregnancy, you don't need to treat things. Like, we wouldn't mess about treating stuff if there's nothing to treat. Like, as in, you don't need to do acupuncture to keep a pregnancy going. It's just, there's some practitioners that say you do that, but I think they're just not maybe grinding the money. That I might get, some people might get upset for me saying that, but look, if someone's had a threatened miscarriage, or there's nausea in pregnancy, or there's things like that, yeah, okay, we can address that stuff for sure, and you should address that stuff. But if there's nothing wrong with you, you don't treat people just for no reason, right? I have had some patients who have had a lot of difficulty getting pregnant, and they want to keep doing the acupuncture after the implantation, if it's been through IVF, let's say, or even if they got pregnant naturally, because they're kind of concerned and very stressed. And there's evidence that shows acupuncture is good for that, and also in IVF associated treatments with acupuncture, that's its best use. According to the research, that for people that are highly anxious types of people, they tend to do better with acupuncture post transfer. But that's kind of getting a bit off topic here. So anyway, what can you do to prevent or treat this? Part of it is for the most part, this is going to be a blood deficiency. So I've got several videos on treating blood deficiency. So eating lots of blood tonic types of foods could help. Sleep is really important. And this is another reason why it's like the trifecta. You've just had a baby, and now your sleep's disturbed because you're getting up for that baby all the time, right? You're producing all this milk, so that's depleting you as well. So there's a lot of depleting going on at that point in time. So it's not impossible to avoid, but it's just kind of that. I guess that's why in Chinese culture they pay so much attention to these foods, and these, like, they're very exorbitant foods. Like, they're using lots of herbs with the cooking. They're I mean, a basic example would be chicken stock soup. Like, at the very least, that'd be kind of the highest order of in Chinese medicine, blood nourishing foods in a postpartum sense. And it's often cooked with ginger. Like, so often these foods after you've had a baby are like warming you. You don't need that warmness before you're going to give birth. You still need that nourishment, but you don't need to have a lot of warmness, like a lot of ginger or stuff like that before. Yeah. All right. Radiant Fanatic says, how's your carnivore journey going? Yeah, so good. What's today? The 24th. So 24 days. I've been doing this thing called 75 hard. I just finished my second workout before I started the stream, which was a walking outside. So you have to do 2 workouts a day. One of them's inside, or one can be wherever you want, and the other one one of them has to be outside. It's been a real challenge doing the workouts today because it's been really hot where I live in Perth. Like, on Monday, it was 44 degrees Celsius, which is like really high. I'm not sure how much Fahrenheit that is, but I'm sure the UK people follow Celsius. Like, it's just really hot. And then the overnight temperature was like super hot. It was like 30. So I was like, okay. I went to my brother's pool and did sort of star jumps and, running up and down in this pool to sort of do my workout. Anyway, but the carnivore stuff, like, yeah, the first couple of weeks, like the first week is I'd say is definitely the hardest, just because who doesn't find that stuff hard, especially if you're coming off of carbs eating and things like that and coming out of Christmas. And then this week's probably been, I've had a few times where I've thought, oh, you know what? I just feel like a bit of something else, like anything else. Like, but then I was like, yeah, I'm not really. Then you think about it again. You're like, yeah, I'm not really that I'm not really hungry. I'm not really, no. Yeah, so I'm finding it good. I mean, I definitely feel better doing it. It definitely suits me, the carnivore stuff. So the program that I'm doing is called 75 Hard. It's by a guy called Andy Frisella. He had a podcast sort of talking about it, and he's kind of created this program himself, and it's like a mental he calls it a mental toughness program in a way, right? So you just kind of have to do all these tasks every day, and if you don't do them, you do them no matter what. If you don't do one of those things, you've got to sort of start at the day 70. You got to start the day one again. So this is the third time I've done the 75 hard, and each time I've done it, I've lost weight, but I also you just you just get more challenged, and it puts you into a better frame of mind, I think. And one of the things is no alcohol, right? So I'd happily have a few bottles of wine over the weekend, if not through the week. If I'm being honest, I love red wine. So yeah, that was probably hard at the start to kind of not have that. But yeah, the carnivore stuff is it's definitely interesting. Yeah, so I'm no nuts. So I'm doing strict, I would say, as what most people would consider proper carnivore. So what I am it's better to ask people exactly what they're having. So I'll have any kinds of meat. I don't eat seafood. I've never eaten seafood. But like, say for instance, today I had chicken, and then I had to just eat a steak, because the chicken doesn't satisfy you the same as a steak does. So you've got to have red meat, and I'd have at least one steak a day. Eggs, I'll have, so eggs, steak. I mean, sometimes I'll do a slow cooked meat, which is great. Like, that's kind of an easy way to make something to go to. So if you're busy, especially when I'm in my clinic, I can't just sort of cook up a steak at the drop of a hat, because it stinks out the clinic. So I might go in the back kitchen and cook up a steak. Like, then the patients come in, it all smells like meat. That's not going to be a great scenario. So what I'll do is sometimes cook up a meat and have that as a spare meat. Or hard-boiled eggs. They're a good snack to bring to work or bring with you. You don't really try to have snacks, but you know. So I'll usually have between 2 and 4 eggs a day. Probably and 1 or 2 steaks between that, and that's usually what I'll have. As part of this program, you have to drink a gallon of water, which to me is an exorbitant amount of water. And I'm doing it because I want to do that program, but I also find that drinking that much water is not a hardship on this program, because a lot of the stuff you eat on carnivore is very, very dry foods or dry cooking methods, like drying. And I'm constantly, I know I bang on about warm cooked and moist. So it depends on how much, like if you cook the juiciness out of your meat, then it is going to be a lot of dry stuff. So you kind of need that moisture and you need that water, and that's good. So yeah, I just drink at room temperature, the quality H2O, just the water. So that's good. I mean, I'm not forcing myself to drink water. I think I would naturally just drink at least 3.5 litres. 3.75 litres pretty much is a gallon of water. Last time I did the carnivore thing, I had nuts, and I just assumed it was part of it. And look, it is keto. Like, you could have a certain amount of nuts as keto, but I feel heaps better not having the nuts. And I think also nuts were, like, keeping nuts in the diet was one of those things where you're just like, you're not having a meal of nuts, so you would eat them as a snack, and then you would eat more nuts than you even why you're having them. Like, so this kind of doing carnivore kind of gets you out of snacking, because you're just full from the food, and then you're like, okay, I don't need to sit there on the couch and snack on foods. So yeah, definitely. And what I found last time is I really love macadamia nuts. And there was a few times when I accidentally, I mean, you can't say accidentally because you know what you've done, but yeah, I ate a whole bag of macadamia nuts, and then I felt really, really sick. And it would have definitely been those nuts, because there wasn't anything, and I think the last time I did this, I wasn't as aware of having more fat. So maybe I was craving the macadamia nuts for the fat in them because they're so fatty. I mean, they are really delicious. Half a cup is 200 calories. Yeah. I mean, the good thing with carnivore, if you're doing it, you don't count calories, and you don't a quarter of a cup. Yeah, it sounds about right. Well, I was eating 400, like a bag of like these massive bags from Aldi were like, oh, one time I ate like almost a whole bag of them, and that's when I felt so sick. And then I was like, right, I'm never doing, I'm never having these nuts again. Yeah, so because they're so salty, and you just kind of sit there and eat if you're hungry. Yeah, so yeah, that's kind of what I was doing, but I'm not doing that now. So yeah, I think what was I going to say? If you're someone had a question. Okay, great, a Chinese medicine question. Otherwise, I'll just keep ranting on about this stuff. When you massage the calves, should you go in an up or downwards? You always go down. Okay, always go from top to bottom. I'll see if I can. Let me just quickly look for a picture and see if I can add this. There's a point called bladder 57 on the back of the calf, right between the gastrocnemius and the yeah, great, here we go. So I'm going to put this is a great little picture. I'm just going to steal this one off of some kind of website here. This is perfect. All right, we'll put this in the thing. Okay, let's see if I can add this. So this is a great point to kind of know, especially if you get like you get cramps in your legs or calfy kind of pain. Okay, so I'm going to add this little picture in here, and then I'll show you where this point is. Right, so you can't see my mouse on here looking at the thing, but where you see the white, and you see the two bellies of the muscle kind of coming together like that, and then underneath that, there's an acupuncture point right there. So that point is called bladder 57, right where the red and the white meet together in that thing. So that muscle's your calf muscle, which is your gastrocnemius muscle, and that's a point. So how you could press that is just kind of like press it. Oh, touch the mic. Just kind of pressing in. Yep. So there's a thing with Chinese massage that everything goes from top to bottom, no matter whether the channels go up or down. If you don't go from top to bottom, the person will probably get sorry, I nearly deleted myself from the chart then. The person will probably get lightheaded or dizzy or feel nauseous. So you kind of have to go from top to bottom all the time. So like you'll see that with Twainer, they'll sort of rub down, like do the, if you were to, I'll sort of show you on myself, like we kind of go down like with a rolling or whatever pressing, you sort of like, it's got this kind of rhythm where like I'm kind of moving my hand up, but I'm not pressing down on the body. I'm just kind of lifting it up or dragging it up. And the pressure is kind of from top to bottom. And yeah, when I've taught massage students that, yeah, kind of just, you have these like general rules with acupuncture, acupressure. And that's one of the golden rules. You've got to go from top to bottom. Yeah. So yeah, you could just kind of go around there. All right. Someone's got a question here. Great. Hello, Indigo Fire. All right, I'm going to add your question to the thing. Okay, here we go. All right, question is, what could one unknowingly be doing that is making purging dampness difficult? Yeah, there's lots of things probably unknowing. You don't know what you don't know. I worked with a great TCM doctor recently, and slowly made the recommended dietary suggestions. Yep. So that's great. Congratulations. I'm glad you found a good practitioner. That's really important. So you might find differing advice on foods for dampness, and this is no like your practitioner's doing the right thing by telling you to eat beans for dampness, let's say, because it's common. Like I've got in my office, I must have 20 different diet therapy textbooks. And they all say that, right? Eat beans to kind of have to treat, like beans drain dampness, beans treat dampness, this kind of stuff. So yes, they do that, and there's lots of purgative types of foods that treat damp, but they're not going to help you long term, because how you want to resolve the damp ultimately is you have to make your body like raise its yang, raise its function, raise its spleen chi, however you want to think of it, all the same thing, essentially the same thing, like to make your body inhospitable to the damp. So think of it exactly like a damp house. You guys are probably from the UK, right? Or let's assume that you kind of know what a damp house is. Like where I live in Perth, it's very dry. We don't really have a lot of damp houses here. You can get them, but it's not that common, right? So what treats dampness is sunlight, essentially heat. So if the environment's just always wet and moist, if the environment's always cold, it's very hard to get rid of that dampness, right? So the signs that the dampness is going away would be less brain fog, less cloudiness in your thinking, less or no bloating, and your bowels. Your bowels is the big one. So you see in TCM books, they say diarrhea is associated with dampness or looser stools, but it's not just that. It's like the perfectest bowel movement is there's no dampness there. So it's not too dry either. It's not sort of hard to get out or things like that. But if there's sort of like you go, or there's a lot of waiting to go or pushing to go, and then it's sticky, there's lots of wiping, that's a very common type of like spleen chi dysfunction, let's say, it's a kind of a type of damp there. It's not explicitly like loose necessarily, right? So if you go and eat lots of probably fruit or, loose, like you might give yourself diarrhea. So that sometimes I think people might get a result with some foods, but it's not a long-term food solution. That could be something unknowingly that people do, right? So just the concept of purging shouldn't be done long-term. If you're purging something, it's all purging out. You don't purge. That's reckless, like treatment for a practitioner to think that, right? Now, it's normal to think we want a detox, right? Patients come to me, I want a detox, Chinese medicine doesn't really have that concept as part of its repertoire for the mainstay sort of treatment, right? Purging is like you're going to vomit it out, or you're going to purge it out. And there is use of purging, but there's more in the textbook that has the formulas for purging. If there's any experts on the Shanghanlun, they can correct me if I'm wrong, because I might be wrong, but I'm gonna guess this here as an educated guess, because I haven't counted the exact amount. There's more lines about cautioning against the purging and the detriment of what's happened from patients being purged than calling for the purging and saying this is what you do and you should be purging them, right? And they often use this terminology, which is a translated terminology from the Chinese, which is called swiftly purge, right? It means do it quickly, but we don't do it every day forever. So a purgative kind of treatment, and this might just be semantics, like just the words you've used, or maybe your practitioner's using them and not really sort of realize what they've said. A purgative treatment, I've given this to a few patients, right? And I've even used this on myself recently once. it's kind of an unusual kind of use of the purging. Well, not unusual, but not a common way of doing it, right? But so I'll give the herbs to them, and often there's 2 formulas that they might need to try, or they're literally these are patients that take herbs from me all the time. And so they're used to having, like, normally when I'd prescribe a formula, it's going to be here's a week, here's 2 weeks, here's a month of herbs. I'll give them like 2 days of this thing, and I'll be like, yep, you'll know. You won't. And one is you won't want to use this for more than 1 day. And then you'll know if it's worked. So often we'd use this for like constipation, bloated, blockages. And a practitioner will often try something else before they resort to that. Like you might say, okay, we're going to harmonize, we're going to move it that hasn't worked, and then they've got this blocked, and then we're going to purge them. Those formulas are very salty. They work very well, but when you're purging something or detoxing or pushing something out, by means of it doing that, it's pushing everything out. So that method of purging damp with beans is a swift treatment. It shouldn't be something you do all the time. So what's the other alternative to treating damp? Raising the yang. And so therefore you need to find a classical Chinese herbalist that can actually give you yang tonic herbs, because it's not used in other fields of Chinese medicine. As far as I know, they just don't use those yang tonics properly or at all. They're probably scared of using them, or they don't know haven't been trained on how to use them properly. So TCM has chi tonics that they use, which are still good, but they're just not as warm. So it's kind of just hotter herbs, warmer herbs, that literally makes that environment as warm as it normally should be, and then the dampness can't survive in there. It's like if you imagine your digestive fire, which I've used this analogy many times on the channel, like fire below the cooking pot. What happens is as we get older, that digestive fire gets weaker. The power of the metabolism's weaker. And like any little thing you eat can make you very upset. Whereas when you're younger, yeah, you can eat different foods that make you, that they're not great for you to eat, but you don't get like super sick from it. You can sort of soldier on a bit more. Why is that? Because you've just got more power there. You've got more digestive fire. So kind of what we're trying to do with herbs is raise that yang, raise that digestive fire. One of the herbs that would do that is ginger. Fresh ginger kind of works on the stomach. Dried ginger kind of works at the core of the gut, right? Like in the intestine, in the small intestine kind of area, and kind of helps dry like that. So that's another way we treat dampness, drying dampness. Man, there's just so many. I don't like, this is a very broad question, which is great. I just there's probably lots of things that one could unknowingly. I mean, the most common thing I see people doing, I don't think this is what you're doing, is people think I'll have a juicy smoothie kind of diet to be healthy, and they're actually giving themselves dampness. I see that commonly with patients. It'll be like the first time they come in, because after that they'll either leave and never come back again, or they change their ways, or they make the changes slowly themselves and realize, oh yeah, shit, that those juices were actually making me feel really uncomfortable, and I didn't realize that until I stopped having them. All right, we've got another question here. If there's a follow-up to the damp one, you can feel free to ask it. That's totally fine. But hopefully that was enough. Hopefully that's an answer, a bit of an answer. Okay, got another one here. Okay, Radiance Fanatic. Okay, TCM question. If you've experienced an injury and you suspect you have a circulatory issue in one of your legs, what is the recommended in TCM to boost your system's circulation? Okay, so you don't have to answer this specifically or anything. You mean like you've had a trauma, and that's so either like the trauma's blocking the circulation, and the circulation isn't as good as it was because of that injury. And the treatment would then be focused on treating the injury and removing the blood, what we call blood stasis, blood stagnation. I can kind of explain more about that. If you are like, oh, the wound isn't healing as well as it should be, or this, I've had this injury and it's not healing as well as it should be, or you've sprained your ankle, for instance, and then it's like, man, it just keeps on swelling up, and why it won't heal as quickly as it should, or something like that. Yeah, right. Trauma and fault and injury to the right leg bone. So there's a few ways to approach it, right? Just going to see what your question actually was, so I don't go off on a tangent. What's recommended in TCM? Okay, yep. So firstly, nutrition and diet, right? So you need, your body's going to be looking for resource to heal it. So collagen, you could try those collagen powders and things like that can be used, but bone broth and like things like that. Sorry, I'm just reading the chat at the same time. I probably should focus on one thing. It's not anyone's fault. I just thought it was part of this, but it's not. So collagen, your body's going to be looking for that. It needs to repair, okay? So higher protein might be needed for a while, or meatier kinds of foods is good. And that can kind of help your body, give it the resource to repair, right? But now your body's like, okay, got to get the circulation down there. So, and this is kind of what acupuncture does. Yeah, it's just moving stagnation, helping things move to that area, regulating that flow, but it's less, usually less, like you can do acupuncture without causing more trauma there, whereas you might do that if you're doing massage, like if you've got, some kind of injury right in the middle of, like, I'll use my arm for, touch the microphone. I'll use my arm for an example. So if the injury is sort of here, right in the middle, I'll put this there where the injury is, right? I wouldn't be able to massage across it because this is all, buggered up here. So we would stick needles and do acupuncture here, and that will sort of draw that, draw the blood flow through here, and without having to mess up this area too much. So you could do the same thing with acupressure, right? So you're just basically pressing the points. Now, you could look up on a chart what the channel is, where the injury is, if it's on your right leg, if it's on the outside of the leg, the lateral side, then it's probably going to be the gallbladder channel and the bladder channel. They're the two channels that are there, right? The other channel that's there that's kind of more along your shin bone is your stomach channel. So it's either of those. There aren't any other channels there. So then you can look up points that you could press. So you could press what we call the distal points. So you could press the points on that channel that are far away from the injury. You could press points above there and in there. You want to get more blood flow to there. Now, when I was studying Chinese massage, I started discovering in the hospital that they would use a lot of heat. I would say this with a bit of caution. So most people need some kind of training on how to use a thing called moxibustion or moxa. I'll sometimes give my patients moxa to use at home. There's a high chance of you burning yourself with moxa if you've never used it before. But moxa is one of the most powerful things acupuncture's got. So if you've already got a practitioner and you're already seeing them every so often, or you can just go in to see them, and you can ask them, look, can you show me how to use moxa for myself? I want to be able to use a moxa stick on myself. Can you show me how to use it safely? Hopefully they're going to be able to do that. Now, some practitioners just refuse to do that. Other practitioners are like, yeah, no worries, I'll show you how to do that. So you can buy moxa sticks very easily, and so nothing's to stop you from buying them. But yeah, you just kind of need some kind of help to show you how to use them. And so I won't go into how to use a moxa stick because it's going to be beyond the scope of this stream. But okay, this is the first time you're hearing about moxibustion. So how moxa works is it's literally creating an infrared heat, and it's tricking your body into thinking it's getting getting a more severe burn than a first degree burn. Now, a first degree burn is just a redness, and when you've got that redness there, your body thinks, oh shit, a more serious burn might be coming, and all the healing properties for the burn kind of are flooding the area, which then helps the healing of the original problem. That's a very broad way of kind of trying to explain how it works. So any kind of heat can be good, infrared heat, but you can't just use heat on an injury with no movement. So going back to my story about when I was in China, I had a really bad and good experience, right? So I fell a bit, not badly, down the steps. Like there was these like steps that you'd have to walk up to the hospital, to the trainer department where I was working on the 4th floor. And one of the days I sort of just tripped a bit and I squidged my ankle, right? I'll go like that because, anyone who's, I don't know if squidged your ankle is a technical term. It's not, but sprained it, right? And I was like, oh shit, like I'm going to be hobbling around here. This isn't great. Like, on my ankle. And like I'd gone into the clinic, and one of the doctors that I was working with, I told him that that's what happened. And he was like, oh, I'll do some toner on it. I was like, I just heard it right now. I was like, don't I need to rest it, put ice on it? Or, I just graduated Chinese medicine, and he's like, no, don't put ice on it. Like, we can treat it right now. And he starts really aggressively massaging my leg, my upper part of my leg. So let's say this is your ankle, like at the wrist. So he was like sort of massaging this, and it was hurting. Like I was nearly crying from the pain. It was like in Chinese medicine, we'd call it that your spleen channel, which is right on your side of your tibia. And it was like, I was just like, oh man, this is like so painful. But I was just like, okay, I'll trust and let him do that. And he wasn't massaging on the ankle or manipulating the ankle at all. And he used some kind of heat on it or something. I can't remember what it was. Like this wasn't in the acupuncture department. I mean, he could do acupuncture if he wanted, but he was just doing tuina, which tuina is Chinese massage, if people don't realize what that is. Anyway, I woke up the next morning and it was almost completely better. Now I've sprained my ankle before, and it was starting to swell up at the time when it happened, and I was like, oh man, I'm going to be hobbling around all the rest of the few weeks I've got left in China. This isn't going to be good, and I was like, it's getting sad that I wasn't going to be able to cycle around on my bicycle at all times of the night or whatever I was doing back then. But it was totally fine. I mean, it probably took a few days to completely get better, but it was heaps better. Actually, I've got a little piece of moxa on my desk here. This is a little bit of a moxa that's wood. So this is by no means at the size of a needle, but this is an acupuncture. This is just a pen. But often with moxa, it would be like we would put it on the end of the needle. I won't light it up because it'll make everything smoky, but it was just kind of light. We would light this up and the heat will go down the needle. That's not the kind of moxa you can use on yourself, but you can get a bigger piece of this stick, a big roll of it, and you just kind of hold it over the points, not on them because it'll burn you directly. So there's a few things that moxa does that nothing else will do. Yep. So the application of heat is part of it. It's infrared heat, so it's better than a hot pack. Hot pack can kind of get dampy kind of feeling underneath there, and that might not be great. Moxa is a blood moving herb, right? And before I said if you got that injury, you got blood stasis there, which means stuck blood, old blood. Like, we want to move that, as that's what will happen as the trauma, right? So moxa is, the herb itself is kind of going to infuse in there. So that whole thing I said about the heat with the tricking your body into getting the burn, that's one part of how it works. But then there's also the part of, okay, well, why? Because it's very smoky. And when I use it in my clinic, I'm not that a fan of all that smoke. But if we just use a heat lamp or something else, it's just not as good. It's not the same. So there's something about the actual herb itself that's probably doing some of its benefit as well. Anyway, so that's something you can look into. Certainly acupuncturists should do moxa. Not all of them will do it. Like they all, I get trained in it, but it's very smoky. And sometimes, like, you know, there's been times when I've been in practice where other practitioners have been in the same clinic and they've been like, oh, I can't handle that smoke. And I'm just like, well, that's part of what I do. And then I was working at a clinic once and they just forbade me to use it. And I was like, well, okay. Then I left there after a while because I didn't understand the power of it, and that, you know, these naturopaths are kind of like, oh, they just didn't like the smell of it. But it's kind of just something you have to deal with as in the clinic. But yeah, I understand that there's places that won't do it because of that. So it doesn't mean your acupuncturist is a bad person if they don't offer moxa. Yeah. So yeah, hopefully that's some stuff you can do. And I'm assuming that's why you were asking about the calf thing, right? So that point that I mentioned before, it's called bladder 57. You know, there'll be some key points that are bladder 57 or 58, whichever one is the most sore. You know, it's right in the middle of that gastrocnemius muscle, and the rest of that muscle kind of comes down into the calcaneal tendon, which comes right underneath the foot. It's a great point to kind of use. The other side, if it's more on the medial side, on the inside, you just look up an acupuncture points on the inside of the leg. So it'll be kidney channel, like kidney 3, kidney 6, and then even kidney 1 is like right on the sole of the foot. So if it's very swollen and sore, you don't have to press right on the spot. You can just press either side of it. And I think you said something like you felt good when you were pressing. You know, when you said you massage it, it's starting to feel better right away, right? So it's promoting blood flow. And when you promote blood flow there, two things happen. More new blood comes in, and then that blood flow actually helps the exchange of the, you know, all the trash that's kind of there, right? So fluid vessels in your body rely on nearby blood circulation. You don't need a specific oil, something that's heating. So you've got all these things like tiger balm, woodlock, liniment, all these. Like if you go down to Chinatown or anywhere, I don't know where you are exactly, but there will be this sort of stuff. I mean, menthol. If you're in Australia, there's a product called Physio Cream, which I find is really good. It's got arnica in it, which is actually good. New York City, okay. Not familiar with. I don't think you have physio cream there. It's just like a cream that we have in Australia. Yeah, so all of these creams, Tiger Balm and all whatnot, they have menthol in it, and that's what makes it feel cool, hot sort of thing, right? So yeah, use the arnica gel that'll help with the bruising and the healing, but you'll also just, anything that's a bit heating, it doesn't really matter what you use. So if you get desperate for making an oil, this is what I used to do back in my old Chinese medicine days when I was a student, is my teacher used to say, just get a little jar and fill it with whatever oil you've got around the house, if that's all you've got, like olive oil or whatever you want to use, and then put a chunk of tiger balm in the bottom of that thing, and it'll dissolve in there and it'll make it sort of a mentholy kind of oil. Okay, you can buy menthol just by itself and make your own. So in Australia, we call it deep heat. It'll have menthol, camphor, it's something like that, right? I mean, there's also another brand of something called Lop Sum On or Po Sum On or something like. Literally, that's its name. It sounds a bit like racist or something, but it's not. It's called Po Sum On. Like these little Chinese brands. I mean, they like. If you go into your Chinatown, you see these little tiny bottles of stuff. They're essentially a bit of this, a bit of that. They're all kind of the same. That's just use that stuff. I mean, some of them just can be hotter than others. The other thing you could try, you mentioned a capsicum thing, like capsicum roll. You could try that, or if the capsicum is too hot, mix a bit of that roll thing, the capsicum roll, with normal oil so it doesn't burn you. Yeah, mini bottle of Tiger Balm perfectly. So just rub a bit of that and mix that with your normal oil to get the thing to do the rubbing. But actually with Twainer, there's not, I mean, it'd be hard to do this on yourself because you don't know how to do it, I guess. But it's actually through the clothes. So it's kind of just a rubbing kind of method, like this kind of thing, like what I'm doing on myself now, like this kind of thing through the clothes. And it can kind of, you don't have to necessarily have oil there. Be careful when you've got an injury like this that you don't give yourself what's called a chemical burn, which is like, I've seen this with patients with really bad sciatica or back pain. And they can't see because they've rubbed it on their back sometimes. And there'll just be a big patch of redness, like a burn. And it hurts, but because their original pain's there, they probably can't feel it that much. But what happens is sometimes you get a reaction because you're like, oh, I'll put a little bit of tiger balm and a little bit of lavender oil and a bit of this and a bit of arnica and a bit of that and a bit of that. You keep rubbing all these different things on. And some of these things can have a really strong residue. Like you rub it, you even have a shower, and then, there's still residue there, and you rub more and more different things in. So just be aware that you don't compound that effect with too much stuff there. Got to be careful with that stuff. All right, so we've got a couple other questions here, I think. Indigo Fire. So thanks for all this. With regards to foods, wondering if you're familiar with blood type diets and if eating foods that are meant to be avoided are adding to the negative effects of TCM. And then she's gone on to say, or he or whatever, didn't mean to say the negative effects of TCM, but the things that TCM believes is a negative or positive to support the dampness, purging, spleen deficiencies. I'm not sure so much about that question. So one, I think the start of it is I don't know much about blood type diets. I mean, I know that they exist. I mean, if it was a patient of mine, I'd probably have to go and research what they were required to eat for their particular blood type, and then look at that against their diet regime of understand what their blood type diet is, what they're eating, and then think of that against their pattern of disharmony. So there's nothing that I've noticed in my practice, but partly because this is the second question I've had on blood type diets in these streams. It's just not that popular in Australia at the moment. Like it used to be a bit popular about 6 or 7 years ago, I think. But like maybe it's just fallen out of popularity. Like I have not had a patient in the last 2 years come in and tell me they're doing a blood type diet that I can recollect. So it's not something that's really like on my radar to think about. I mean, I did something in the stream last week, I think, or a video on this separately. Maybe it was the stream. Like, whatever diet you choose to do, you want to try to have mostly cooked foods most of the time. That was one of my old teachers' sayings. And it's a good saying. Have mostly cooked. So it doesn't mean you always have to have cooked foods, but like the majority of your food should be cooked. If your diet requires you to have a lot of raw, that's going to be an issue in Chinese medicine, right? So most of these blood type diets, I'm sure that they can fit in with that philosophy. Then you want to optimize that by having things warm and, moist kind of methods. So not too drying, right? Like frying and baking and things like that, trying to avoid too much of that. You can have some of that. Again, it's a balance. It's not like always, every time, forever. The sicker you are, the more issues you've got, and the more committed you are to healing yourself or getting better, then you want to maybe have more of a commitment to that. If you try something half-heartedly, whether it be the blood type diet or a Chinese medicine principle, you won't know if it's working or not working if you didn't try it properly. So you kind of have to commit to it for enough time. The only reason I'd stop doing it is if you feel significantly worse and you're not under the care of a practitioner. And, like sometimes you do something and a practitioner's like looking after you and they'll be like, oh, that's normal. Like I might give some patients some herbs and they've got diarrhea for one day. I'm like, they call me because I tell them to call me. Oh, Marie, I've got diarrhea. Should I stop taking the herbs? No, you keep taking the herbs. I'm glad you've called me. Another case, I might be like, oh yeah, you shouldn't have diarrhea, or they've had it for 3 days. Okay, yeah, stop the herbs. So if you're just going along singing a song by yourself, trying to make sense of it all, it can be hard sometimes to think, how long do I keep doing this before I stop? If certainly if you're getting detrimental things, you're worse. But if nothing's happened, you might not have given it enough time for it actually to work, or maybe you've not committed to it properly enough. All right. Great. Radiant Fanatic says, thank you for the great info. You explain things so simply, and I've happily found your channel. I'll be watching all your videos and sharing my family and friends. Great. Awesome. I'm glad. Hopefully, that's my job done. I just want to help people understand Chinese medicine and be able to use it for themselves. And there's like a lot of stuff in the repertoire of Chinese medicine that is for self-care, self-help. And yeah, there's no way, I mean, I don't have this time in my practice to kind of share everything. And like, I found that people like to talk about stuff probably more and more and more, and which is great. But then there's all this other stuff that you want to share with people. So that's kind of why I do these streams, to kind of help create, well, not just the streams, but the channel, right? To help people like learn about it, for people that want to do that. Not everyone wants to do that. Some people just want to be, they just want to take their herbs and go home. They don't want to learn anything, and that's totally fine. Yeah, I'm glad you caught the live too. Yeah, look, we all have the commitment issues. Everyone has that. Like, it's normal. Even me, sometimes I'm just like, oh, it's not working. Or you've only been trying it for like one day, or 2 days or something. And you're just like, man, I want to get these results. Or, like, part of it's, I think, is also the trust in the original thing. Like, the thing you're trying to try, is it worth me? Because a lot of these things, they're going to cost you. They're going to cost, oh, I can't drink alcohol. I can't have any tasty treats that I love, or whatever the thing, if it's a diet to lose weight, or I've got to go and exercise like 3 times a day or 2 times a day, or whatever they're asking you to do. If you don't realize that that's going to work, or you don't know, then you won't do it, right? Like, the first time I did this thing that I'm doing now, this 75 hard, I knew about the program for at least 3 or 4 years before I did it, because I follow the guy on his podcast for business stuff, right? Entrepreneurial things and business stuff. And he also, part of what his business is a supplement company, and he's in the fitness space and supplements and stuff. And he invented this program because he himself had just had too much of the good life. Like, he's got very successful in his business, still was super successful, and started putting on weight and got fat and overweight. And then he's like, I'm going to do this program. He invented this program for himself. And then he's like, okay, documented it. And then he's like, okay, I'm going to tell everyone else about it. And, you do it. And I told my sister about it, because I was like, oh, my sister was is more like, she's much more committed to diets, as in, like, she likes doing different programs and trying different things, and she's really fitness orientated. Like, she's really into working out and things like that. And I used to be a bit like that, but now I'm just like, no, I'm not really into, I don't have my gym membership anymore, for instance, right? And yeah, she did it, and she did it first, and then I was like, okay, right, I'm going to do this. And part of the whole thing is you have to be, I believe you have to be motivated yourself, like, and then you're going to do it. Like, no one's going to tell me fucking nothing. I don't want someone to tell me you got to do this. Like, I have to tell myself I'm going to do this. I have to be ready to do it myself. And so once you've got that and you're like, yeah, I'm ready to do this. What's great is if there's a program or there's something that you're going to choose to do, and it's going to be beneficial for you, whether the results happen or not that you're looking for, and it's more like a lifestyle thing, which is kind of partly why carnivore appeals to me. The carnivore lifestyle kind of appeals to me because it's something I can visualize doing regularly, because one is you're never hungry, like you're never going to be starving. And I'm like, I don't want to do some kind of diet where I'm starving hungry all the time, because that's what's happened in the past, right? Everyone's experienced that who's ever tried to lose weight. So yeah, when I first started it, I wasn't expecting anything to happen necessarily. I was like, I'm just going to do this. I'm going to commit to it. I'm going to do exactly. And like, it was the first time I'd ever lost weight straight away doing something. And that was not on carnivore. That was just with a weird diet I made up myself, which included pasta in the diet. And I still had lost 10 kilos doing that 75 hard. I didn't eat a lot of pasta, but I just made this sort of moderate. I don't even know what I'd call it now. I can't remember what it was, but I'd allowed myself to have, like, you basically pick a diet and stick to it on this program. So you can't choose to have candy or stuff, but I was still having carbs. And that, so I wasn't doing anything to do with ketosis, and I wasn't counting any calories or whatever. But I was just like, okay, there's not going to be this, there's not going to be that. I was only allowing myself to have the pasta or any carb meals at lunchtime. That was the rule. Look, it worked, but I definitely didn't feel like I feel now. I didn't feel as good as I feel now. So yeah, let's talk about leaky gut. So we've got a question here about this, which is a great question. So what's the best way to heal leaky gut? So yeah, I mean, if you're already eating foods or things that is not eating food. Sorry, let me just put this in here. This is not the only cause of leaky gut, but for some people, medication, non-steroidal anti-inflammatories. If you're in Australia, the brand is kind of like the Nurofen and stuff like that, right? They can often cause this, or for people who've had chronic pain, they've had to manage pain, and then they've taken or some kind of steroid medicine, things like that can sometimes like lead to people having these issues as well. So yeah, Radiant Fanatic has said, according to TCM, what's the best way to heal a healthy gut? And then, yeah, the next comment was related to what I was saying before about the pasta. Yeah, pasta's dangerous because I've had to completely remove it from my pantry. Yeah, and I've had to do that as well. Like, you can't have it there. Yeah, like I cleaned out my fridge when I started carnivore so that there'll be nothing to tempt me. And then yesterday when I was in the fridge, something I was, I thought I'd completely cleaned the fridge out, and then I looked in the back, and there was half a packet of crisps, chips, in the fridge, sort of rolled up or whatever, in the back, and I was like, oh shit, how did they stay there? But it didn't tempt me because I'm committed to the program. I was just like, okay, I was thinking, oh, should I throw that in the bin? And I was like, oh, maybe I'll give it to my nephew when they come over or something. They probably might, because the other day they came over and what can we eat, Auntie Maria? I was like, there's only meat here. There's no more. We don't have any more cheese buddies, or well, we do have cheese, but this is cheese buddies are this Brazilian cheese bread that you make in the they're like, no, we don't have any of that left. So yeah, sometimes you just have to remove all that stuff. Out of sight, out of mind. Yeah, is the best for whatever works for you, right? Yeah, especially the first few days or week. And then after that, I'm usually fine. I can look at it. I can go through the shops, no problem. Like the first week I did this, I couldn't even go to the store. I went to the shop on purpose, bought everything I needed so that I wouldn't go to the store hungry for 2 days into it thinking, oh, you know what, I'll just start it in 2 days. Because that's what happens, right? You think, oh, I'll just start it in 2 days. I'll just start it tomorrow. Anyway, so I suffer with this stuff just as much as anyone else does. Yeah, so what's the best way to heal a leaky gut, right? So there's herbal formulas that can do this. I can't tell you what the herbs are because they're very dangerous if you don't need them, and they have to be prescribed by a practitioner. It's not something you can get over the counter by any means. So there are herbs that it's basically there are yang tonic herbs, super restoring function kind of herbs, very warm herbs. Licorice and ginger are also a part of the core formula that would kind of treat this. Often, not always, but it's a common combination. And then there's another herb in there with it that kind of does that. And the other herb's kind of the main one. So I just don't want people to recklessly kind of do that. Now, again, it's going to sound a bit like a repetitive thing in a way, but diet-wise, you're basically just taking the pressure off the system. So putting in foods that are clear, bland, not too many, whatever you do to support the spleen and stomach, basically. Not too much combinations of foods. If you just did that all by itself, would that be enough to heal the gut? Maybe if you had a lot of collagen in the food, so the bone broth, the marrow, that kind of stuff. Gelatin would be maybe another food that could help you with that over a longer period of time. Like there's certainly people on a carnivore kind of diet that have repaired significant things in their body, right? There's evidence of that. Now, is that because the meat's doing that, or is it because it's such an elimination diet that you're not eating any of these things that are irritating? So anything that kind of irritates the gut lining increases the inflammation, and it's already inflamed there. What the herb that I'm talking about in Chinese medicine does is it's just incredibly warm in the small intestine, so it's kind of like warming that area. Now, ginger, you could still include this in your diet, and you could still use it. Whether it would be enough just by itself, I don't know. But you just so people understand, fresh ginger and dried ginger, they're the same thing, same plant. The fresh ginger you buy from the supermarket or wherever your shops are or whatever, grow it if you can. You can cut it up in slices and then dry it in such a way that it doesn't get moldy. So you could use a dehydrator or an air fryer on a very, very low thing, or if you've got a very hot environment that's dry and not put it outside, or however you dry things. You could make your own dried ginger. I'm sure you can buy dried ginger from Chinese food stores. Some herbalists will just sell you one herb sort of by itself off the shelf. And you could make a tea with that dried ginger, or start adding that into foods, right? What you'd probably do is you'd make a strong tea or use that dried ginger in a soup stock. So chicken soup with ginger is one of the most nutrient foods for your spleen and stomach in Chinese medicine. All that stuff I was talking about postpartum recovery, right? Remember we're just talking that question for that other person about the month of confinement and those kinds of foods. Those foods would do it as well, right? Because they're highly regenerative foods, right? So if you've just had a baby and you're at the weakest point you've exhausted a huge amount of yang to push that baby out, and now your body's like, okay, make some milk, like just become a milk factory, and now hardly get any sleep and all that sort of stuff. So those kinds of foods are like really regenerative, very yin dense, rich, natured foods with the yang kind of warmness. So any of those kinds of things. You could look that up. What are the foods for, it's called the month of confinement, postpartum recovery. And some of them are a bit weird, like quail eggs and, some like weird animals. Chinese love to eat all kinds of animals, like turtle soup and quails and, yeah. So if you think red meat's bad, you just go to China and you'll be eating a turtle in no time or something strange like that. You don't have to eat turtles, but yeah, those kinds of things are nourishing. So chicken soup, chicken stock, bone broth from chickens, chicken bone broth is kind of like the peak of it, right? So Radiant Fanatic says, I've got a lot of herbs in my home, like wormwood, oregano, Korean mint, and anise as well, and licorice drops. Yeah. So look, I can't recommend mixing those all together because I don't know what will happen. Certainly wormwood is kind of like more of a purgative sort of scenario herb. It's for treating infection, maybe infections, but also like parasites and things like that. Can I fast 16 hours and break the fast with the bone broth? Yeah, that's great. So fasting is a regenerative process. One is your body's going to be in a state of ketosis. When it's in ketosis, especially if you're, let's say you're doing a keto diet and, I'm getting a cramp, hang on. I just tweaked my leg in a weird way. I thought, oh no, I'm going to get a leg cramp, but I didn't. If you're let's say you're in a keto diet and you do the fasting, then that's when it goes on steroids. It really, really helps regeneration. But even just 16 hours of fasting, right? When the concept is in Chinese medicine, when you're not eating, your body's repairing, it's restoring, it's regenerating. So you're also giving your digestive system itself a rest. For some reason in Western society, I don't know if it's because we have electricity, I don't know, it's just gotten worse and worse. It's gone from like, okay, you've got a fridge, you can make food, you can keep food, great, that's not a bad thing. And then now it's like, oh, you can, supermarkets are open real late at night, you can get food late at night, right? Oh, that's not such a bad thing, I guess that's good. Oh, you can just call Uber Eats and get like a meal right now, like at midnight. There's something wrong with that. Now, it's not wrong if you're traveling, you need a meal. It's a one-off thing, but like doing that regularly and being exposed to so much food all the time, that's part of the issue I think that people face. Probably not people watching this stream because you guys are all healthy, aware people, but in general, we eat, as a society, we eat too much food and you never give your stomach a rest. So how do you benefit that stomach and spleen, which is your digestive system, your earth element, is you give it a little rest. Right? You just stop using it for a bit, and that's what fasting is. So, yeah. Cool. All right. Is ginger, so I'll just quickly finish the questions on this one and then we'll get to the Dunker Lavelle one, which is cool. Danica, sorry. Is a ginger raw too harsh on the gut? No. You mean eating just ginger, like by itself? Maybe, sorry, I thought you meant just including it in your food. So when I say fresh ginger, like that would be raw ginger, it's then infused as a tea, or as a herbal medicine. It would be boiled and you would drink the liquid of that. So you can take about 3 to 5 slices of ginger and just make a tea out of it, steep it in there, like leave the ginger in there, add the boiling hot water and then just drink it. Add your other stuff that you're having with it, right? You're saying you blend the ginger with the lemon and you drink it raw. I think that's okay. If you feel nauseous after that or you feel acidic regurgitation, like belching or something coming up, then probably it is for you. But I don't think it's a problem. I mean, one of the things I advise people to do who are like addicted to the smoothies, they won't stop eating smoothies, is you just put a little piece of raw ginger or fresh ginger into it. Yeah. So normally you're just like trying to cook with that fresh ginger, right? You want the juice, like the infusion of the ginger into the water. Yeah. And you could just bring it to the boil a little bit on the stove if you want. Yep. That's basically what you're trying to do there, is replicate how you'd have it in a herbal formula. So there's something to be said about like with herbal medicine, you never eat the herbs. Like if ginger is in a formula, guajatang, for instance, a common formula, like fresh ginger's in there. We don't we get the herbs, like these herbs, we boil them, we drink the liquid, and then you discard the herbs. You don't eat the actual herbs. So yeah, maybe like that is too harsh for you. So try both ways and see how you feel. Yeah. All right. So we've got a little question here. Thank you, Danica. You love the podcast. Awesome. We love people that love the podcast. I'm just going to put your question here on the screen, and then we'll answer it. Do you have any diet or lifestyle recommendations? Hang on. What's happened there? Oh, that's my phone making a little sound. For managing heatiness, liver qi stagnation, and yin deficiency, kidney yin deficiency. Yeah. So, right. So one is that heatiness. It's a really common feeling that people have or symptom. In TCM, yin deficiency is the diagnosis for that, right? So what that means is that what they're trying to say is that yin is less than yang. And so because of that, the yang is kind of the heat that you feel is your body's yang. They're failing to kind of mention that or explain that properly. So either way, in classical Chinese medicine, we don't think about that as the diagnosis. We would just say you've got deficient, your yang is actually deficient, and that's what's rising. Either way, your yang is rising, right? Your yang is, so it's your own body's energy. You don't want to clear that away with some kind of like this ridiculous clearing the heatiness teas. Like sometimes I go to the Chinese food shop and you see that, like, clear the heatiness, clear the heat. So these kind of formulas that are like, Lian Chow and Jin Yun Hua and I don't know, chrysanthemum flowers. The only time you want to do that kind of clearing heat is if you've got a massive infection maybe, and that would be under the care of a practitioner hopefully. Maybe a sore throat, like that's a TCM way of treating it. In classical Chinese medicine, we wouldn't even use those cooling herbs, right? Literally even to treat a sore throat. We would use herbs like chai hu in combination with ginger. Anyway, we won't go down that road. But there's heaps of other stuff we can do for this. So where's the heat coming from? The heat's coming because one is, if there's liver qi stagnation, there's stuckness of that liver energy. And what that liver energy wants to do is it wants to be free. It wants to move. And it's an easy one to treat with lifestyle and diet because it's actually caused by that. So particularly lifestyle. So if you have any creative inkling in you, like you love to do creative stuff and you've been suppressing that and you've been putting that off, then now's the time to do that stuff. That's going to benefit your wood element, which is the liver element, right? The liver, not element, the liver. That can cause liver qi stagnation. If you find yourself sighing a lot, like that, that's your body's way of trying to release the stagnation. And if you notice what you are sighing about, that might tell you what your stagnation is all about in a mental sense. Now, sometimes you just get into a scenario where it's just all happening and you don't know who's causing it or what's causing it. But, sometimes I have patients where they'll come in and they'll be like, blah, 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 this is what's happening, da, 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 and then I'll be like, my husband, blah, blah, blah. Or my dog, da, da, da. And they're sighing. You can often see that people, you might notice this even in your friends and family, people sigh relating to what they're frustrated about, right? So if you can work on that stuff yourself, like that's going to be at the root of the problem. Now, yeah, you can't just always get a new husband or get a new cat or dog, but it might give you something to work on in that way, right? Something to think about, or something, maybe too much to think about. The biggest thing you can do for yourself is singing, laughing, and exercise. That stuff all moves stuck energy. It all moves the liver qi. It increases the flow. Now, when there's a free flow, there's no stagnation. So if the wood element and the liver energy wants to be moving and spreading, and it can't do that, it's that stuckness is actually what's generating the heat that you feel. Like, especially if you feel around the ears a bit tight or you feel a bit better rubbing it. And that's actually something else you can do. You can rub the sides, which is your gallbladder channel. I've actually got this in a video series that I did for people as a course. So it's what is it? It's called Self-Care for the 5 Elements. I think the link is in the description for this video because I just think I keep it there. But if you haven't done that course, it's just a very low cost course. You can kind of sign up for that. And there's like, I put a lot of effort into making those videos with good quality sort of, better quality editing, where I've kind of showed you, here's where the point is, here's how to use it, this kind of stuff. So in that course, there's a bit of acupressure, there's a bit of this and that for these things. But like anything that benefits that wood element, which is all part of that course, like I've just kind of almost given you almost all of them now, but there's more stuff that you can use that's in the course as well. A big part of it is creativity and getting in touch with purpose and life, like, and a lot of people who have qi stagnation, it's all stuck. Like they feel like their life is stuck. They're like, I don't know how to move forward, because your wood element, which relates to the liver, is about life planning. It's about seeing a vision for your future. So if there's stuckness there, it's kind of often part of that, right? And then when you say this kidney yin deficiency, like I'm hazarding a guess that you've got hot flushes or feeling hot or feeling vexed in, maybe it could be heart palpitations as well for some people. Night sweats. Like technically yin deficiency is going to have, you're supposed to have sweaty palms and sweaty feet on, coming and going or in the center of your chest. You certainly would feel like waves of heat, like a hot flush. It could be menopausal, it could just be just a hot flush. Like I've had some patients that feel as if they're getting a menopausal thing and they're 30 years old or something, right? So it could be that, or it doesn't have to be menopausal. And then there's like maybe difficulty with your sleep. So that all can be treated by like tonifying the... Okay, this is a bit more complicated. So the next thing to ask yourself is, do you feel so tired you've got to lie down? Like, have you got that kind of tiredness? Because if you don't have that sort of tiredness, then you're probably not that deficient. If you feel better with exercise, but it's just hard to get going and you feel like there's not enough time to do the exercise, but if you do it, you do feel good, then the wood stuff is what you want to do. The moving chi sort of stuff is kind of what you want to do. Whereas if you feel like I'm just too exhausted and ready to do any exercise and I'm so tired I can't even go for a walk, or you've got to lie down in the day, well then that's different and you kind of need to work on more tonifying your body. So hopefully that would be what your practitioner's gonna give you, that sort of treatment level. So herbs, acupuncture could kind of both be used for that. Like either way, the kind of general sort of clear, bland diet, the general diet advice for Chinese medicine is appropriate for both of those scenarios, because that's just supporting a general healthy spleen and stomach, right? Which is the core of it's just supporting your digestion. But if you're deficient, if you really have that kidney deficiency, then you are going to need to like address the diet stuff or take herbs. Like just doing the acupuncture kind of won't be enough probably. It might make you feel better, but you won't get better long term. So yeah, Radiant Fanatic said, would you also say avoiding sugar and processed foods helps to... Yeah, definitely. I mean, yeah, sort of goes without saying, but we have to say it. Yeah. And what happens is people gravitate towards those foods for a really good reason, right? Like when you're deficient, your spleen, so the earth or the spleen flavor is sweet. And this is like really a conundrum because you think, hang on a minute, sweet, it says sweet nourishes it. But what they mean by that is like the sweet of grains, the sweet that's in meat. Like those two things are actually classified as sweet. Now you wouldn't think meat is sweet. Like, I don't know, like it's not sugar, right? The meat that's in like a sweet potato, I think you guys call them something else, yams or something. Yeah, you can get some vegetables like those kinds of yams that are very sweet, but like carbohydrates, it's basically classifying the carbohydrate family as sweet. Like that's kind of what Chinese medicine is saying that they are. And like that is the nourishment for the spleen, right? And it also says too much sweet is overwhelming the spleen. It doesn't mean sugar, like have a candy bar. But what happens is when you have a spleen qi deficiency, or you are, earth element spleen qi is a bit weaker, if you eat a meal and then you crave the sweet after that meal, in Chinese medicine that generally means your spleen qi is weaker. It's deficient. Now that could be just because of what you've eaten. Basically means what you've eaten then before that has depleted you. Because it's so hard. Like for instance, people eat a big yummy bowl of pasta, and then they're like, oh, I could have a little dessert now, or I feel like I need that, or they feel you eat that food and you feel sluggish, you feel foggy headed, and you're sitting at the computer and you think, oh, I'll have my coffee and my cake now. When I was younger, I used to do that all the time without thinking about it too much. Like I would just be like, yeah, in the afternoon I'll just get a coffee and a cake like from the cafe down the road. I wasn't even overweight. I was like super, super skinny. And I just used to think it, just not think anything of it, right? That much, right? And some people are just in the habit of that. Like, you know, if you go to a cafe, you're like, oh yeah, let me get a little croissant. Let me get a little sweet treat with that, because that's part of that is just your whatever you've put in your stomach is either your body is so depleted that anything you put in will do that, or if it's only on certain occasions, think back to what you ate and think, okay, hang on a minute, like that was so hard it was giving that spleen and stomach, the earth element, just a bit too much work to do. Now it's like going, help me, I'm hungry, and it's craving the sweet. Yeah. So Danica says, I feel better, heaps better with exercise. Yeah. So look, that's a really good sign that you're not too depleted. Yep. TCM loves to dish out kidney yin deficiency as a diagnosis. So I've got this awesome video that I did with my teacher, Laurie Ayres, on the channel, and it says yin deficiency doesn't exist. That's the title of the video. And we're talking about menopausal stuff and things like that, but it kind of relates to any kind of yin deficiency diagnosis, right? And it talks about what it truly is and how to really think about things. But so if you feel better with exercise, the chances are that all that heat that you feel is just from that wood element being a bit blocked, right? And if that resonates with you, you don't have to put this in the chat or anything, but you know, about the creativity, it happens when sometimes, you know, life has changed and you used to have time for doing something, and then just suddenly you don't have, you know, you find yourself in a situation where, like, it's not like you hate your life, or it's just busy and you don't have time to do the things that, you know, you used to be able to maybe do before. And it doesn't mean you have to stop and go back to that, but you need to find a way in your life that fulfillment is there. So let's say you're a single person and you spend a lot of time just doing your creative projects like art or something, right? And then you get married, you're in love, you know, the birds are there and whatever, and then you have some kids, and so all that time you haven't felt bad or anything like that, and then one day you just wake up and you think, oh man, my whole life is just taking these kids from place to place, and you know, I'd never get any sleep, and and you're finding frustrated, you feel frustrated, usually with liver chi stagnation, people get angry easily, they're frustrated, like they're sighing, doing all that sort of stuff, right? And it doesn't mean that you have to spend, like, let's say before you got married or had the kids or whatever, you might have spent 20 hours a week painting and doing frivolous activities that you were doing before. You don't have to go back and do all that, but you might need to make some time in your life, or maybe you explore that creativity with your kids, or you do something that is just for you, or something like that. So that's a big part of the wood element. It's like a need that we have to explore that. Or it often plays out where people change jobs, or you know, they get a promotion that they really, really wanted, and then they find that in that job they're just not as passionate about it anymore, and what they're doing day to day, they're just not as creative as they were. There's no outlet for that thing, so you might need to just mix things up a bit or change it, right? Like for me, like, I enjoy doing this. A minute ago I was thinking, oh, maybe I should stop the stream, because it's getting late. But I won't keep doing it forever. I will stop the stream eventually. But I enjoy doing this kind of stuff. And when you do something that you enjoy, it motivates you and it energizes you. And that is also how it's doing that, is it's tapping into that wood element. Now, you can't do that thing forever and ever and ever, because you will, you know, I couldn't live stream. I've got no desire to do some kind of 24-hour live stream challenge or anything weird like that, because you can't talk forever. But you get the idea, right? So you've got to find a place in your life to have some kind of creativity and that exploration of those things in your life fulfilled. Otherwise, it builds up. And in Chinese medicine, it's like free flow, okay? That's what it should be. Then there's like not a free flow, and then there's a blockage, and then there's stagnation, and then there's frustration, and then there's resentment. So it kind of goes almost in that order, right? Frustration is like, oh, I'm just a bit annoyed about that. And resentment is like, I really hate that. Just like you hate something, or you've like, you see other people doing something and you wish you were them, or you hate that person because they're doing what you would really want to do. And that's not a great place to kind of be in for the people around you and for yourself. But those are all the emotions kind of associated with that wood element. So singing, laughing, and exercise can help. Pungent foods can help. Coriander, garlic, mint, basil, ginger, coriander. What else? Anything aromatic can help. Citrus, if you like aromatherapy, right? Citrus fragrances that you smell can help. Like citrus flowers, like can help, like smelling that sort of stuff. Yeah. So, there's some of the things. The main point that you could probably press for yourself is liver 3. I mean, your acupuncturist. I'll write this in the chat. There's 2 points that are used in Chinese medicine. Your acupuncturist probably used this on you before. And they call this combination the 4 gates. So you've got 1 point here on your hand, right? So this is large intestine 4. And the liver 3 is on the foot in between the web of the first and second toe. So if you think about it, like if this was a foot, your liver 3 is kind of in the same spot. Like, funny that with acupuncture, there's a lot of those kind of combos. So you can look up those points, liver 3, large intestine 4, and you can just kind of sit there and press those points. And the other one would be the rubbing at the side. So they're kind of a few hundred different kind of diet lifestyle recommendations I could give you for those things. And I hope you do feel better soon. And yeah. Good. All right. So we've got another little question here. Is it a question? Let's see. I have a week's radiant fanatic. I have week's spleen chi because as soon as I'm done with soap, you crave sweets, especially when you're cooking way. Oh, maybe that was a comment from something else. Cooking way less because of carnivore. Yeah. So that's a sign of week's spleen chi is that craving of sweet, and a lot of people have it. It's not a rare thing. It's super common. I think it's also just because our food chain and our foods are just so highly flavorized. You've got to ask yourself, this is something I've been thinking about since I've been doing carnivore, is like, when was the last time you just had a food without any, no worries. Thanks, Danica. That's great. She just says, thanks so much. When was the last time you had something without a flavor on it, right? Like, and you just tasted the ingredients for itself. Anything you just buy on, from the shops, it's just got so many things, right? Sugar and salt is one thing, but then there's just so many added flavorings. Radiant Fanatics says, how do you deal with cravings? Oops. I don't want to take a photo of everything. How do you deal with cravings that come up on carnivore? That's a great question. So, the first thing is if you might just be hungry, right? The first thing is that you've decided already, I'm not going to eat anything else. And that's probably why it's easier for me saying I'm doing it with 75 hard. If you had the option, you're like, oh, maybe I won't have that today. Maybe I'll have this or that. So you're like, well, what else am I going to have? I'm going to have some meat. So if you're craving something, or you think, like, for me, a craving is like you're just literally thinking about it firstly, right? Like I actually, to be honest, I think they've gone away for the most part. Like before I did carnivore around Christmas, like I was just eating whatever, like, because it was Christmas and I knew I was going to change. And I was like, I just was like, I feel like a family size macaroni and cheese. I'm just going to go down the store and buy one. Or I'm just going to buy, I very rarely buy pre-made foods like that, but I did buy one. And that's how I remember thinking, shit, there's so many flavors in this. Like, it's just massively flavored. Or make your own macaroni and cheese. And I'm just like, I'm going to make some kind of pasta meal, or I'm going to make a pizza, or I'm going to do this. And if you have it, the more you have something, the more you think about it, the more you crave it. And you'll find that if you start doing, I don't know if it's other diets, but definitely on carnivore, after a week, those things go away. You just don't think about it as much. And they come to mind, but it's not like, oh, gee, I've got to have that. And then the next thing you've got to tell yourself is, if you're thinking about that, like you think, oh, I could have I don't know, something to eat now. I feel like a bit of ice cream, or I feel like this. Well, you're probably just hungry, like, and if you're hungry, then maybe go and get a piece of steak. That's kind of what I tell myself, right? Maybe then you're asking yourself, did I eat enough food today? Do I need to make some steak or make an egg? Or I might have something a little bit little. You definitely get more feelings like that when you first start, like the first week. And I've heard other carnivore doctor kind of people and life coach doctor people, or whatever they call themselves, carnivore coach people. They're not doctors. They've just done it for a long time. They normally say when you first start, eat a lot of food, like eat more food than you think you need. Just make sure you eat regularly, because then you won't have that issue, and you'll be full. And you've got to make sure you have plenty of fat on it as well. So you're going to need to either buy some tallow, make some tallow, or butter, and you need to and have fattier cuts of meat that you have. And if you have plenty of fat, that's a thing called satiation, which is like you feel satisfied. You've sort of, and you then it will stop. So yeah, I think I said before, like the first week I did it, I purposely did not go to the shops because I didn't want to go around the supermarket. Well, one is there's no reason for me to go to the supermarket anymore because I'm not going to buy my meat from the supermarket. I buy it from a butcher or a specific meat place. So why am I at the supermarket? Like, I do have to go there to buy milk because I'm still having dairy, right? So I was like, okay, I don't want to go here to buy milk. So I stocked up on what I needed. So I didn't have to wheel my trolley around the supermarket getting tempted by stuff. And then the other day I went to the supermarket, I was like, I'm not even tempted. Like, I had to just buy some fly spray or something. And I was like, I'm not tempted by any of this stuff. Like, whereas before I would have been like, I'm missing out on my Twixes or my candy bars or whatever you think you're missing out on. Because it's all part of the triggering of it, like the packaging, the color, the smell. They tell you when you're dieting, if you've ever done you're trying to diet to lose weight, let's say, never go to the shops hungry, right? It's the worst thing you can do, because you just feel like you inevitably fill up your trolley full of just random stuff, because you're like, oh, that looks good. Oh, that looks yummy. I feel like that now. In Australia, there's quite a lot of meat like butchers that you can get direct meat from. So I normally buy my meat in a big roll of meat and cut the meat up myself. And there's a place called Costco that's American. They have that here. I don't have a Costco membership, but some carnivore people I know go there and get the meat like that. And there's another place in WA called Superchats, and I get meat from there. But I'm probably not going to use that meat long term. But yeah, my freezer's full of that meat because I've had it for a while. I've had that, like, it's good quality for me. But you can also buy meat from butchers, or like butcher boxes, I guess. They ship it to your door. There's heaps of them in Australia because it's becoming more popular, right? And it's definitely cheaper, I think, to be a carnivore in Australia than it is to be in the US, because we have the majority of meat in Australia is grass-fed meat anyway. Like, we don't have feedlot kind of meat. It's just not that common. Certainly not as common as in the US, right? Where unless they're trying to make Wagyu ones where they're trying to beef them up and they feed them. Anyway. Yeah, so that's kind of it. I think we'll probably end the stream on a good note. Not that it wasn't a good note. I mean, just if anyone has a dying question, they can ask it now, I guess. But yeah, that was great. Good times. So this is what I'm going to be doing with these streams, is alternating the time. So it'll be once a fortnight. So if this is your time, not next Friday, but the Friday after. Next week, I'll do one for the USA people time. Find me on my socials. So Chinese Medicine Podcast it's like that on YouTube and Facebook and Instagram. It's all the same. You can also, my clinic one is Bespoke Medicine. Yeah, I mean, I probably put more stuff on the podcast one. The clinic one's just sort of like, oh, we're open today, we're closed today. It's a bit of that on there. And I might just put little videos on the clinic one for people as well, like stuff. But yeah, I mean, the main thing I do is a YouTube, right? Like I don't. If I put stuff on the socials for for the podcast, like if I put stuff on socials, it's usually come from stuff I've done on the podcast, like shorts from that, things like that. Yeah. Because I don't have time to make things. I do have a TikTok as well. We have a Chinese Medicine Podcast TikTok. Yep. Yeah. I like the lives. I like the bit of interaction because people want to ask a question, but sometimes you just need a little bit of back and forth to kind of do that. And yeah, I like this. And it's great if we've got a bit of a good time slot. Yeah, and this is what happens when I'm on the straight and narrow, and there's no wine on a Friday night. I can do a live stream for you. Because yeah, that's why I thought I'd do this, because I was like, all right, I need to fill in the time with something productive. So I'm not sitting there thinking about other things that I might be doing. But the good thing with 75 Hard, I definitely recommend people look into that program. It's free. You don't have to pay for it or anything like that. It's like a mental toughness challenge. So you kind of really are filling up your time very well. So you don't have any time to waste thinking, oh, where's my candy bar or anything else. And like, I definitely think that working out is a good thing to do. And it's not the sort of thing everyone can do it every time. Like I know most people in the world right now are in winter, and like we're in the middle of summer here. Like this summer is the time you should be exercising and sweating, and that's normal. I would not do 75 Hard. I would not do 2 workouts a day. One of them has to be outside in the winter. Even in Perth, it doesn't snow or anything, but like it's just not the right thing to do seasonally. So like if you're in winter right now, you want to be thinking about this stuff. Like almost your new year should be when your summer comes. So like March, April would be like when it starts to warm up. Okay, spring's coming. Like that's the time to make the changes. That's the best time to kind of do that. Spring is the best time to do new things in Chinese medicine. So yeah, if people are kind of thinking, oh, I want to change, I want to do something new, you've got time. You've got time to kind of come decide it and make the changes. Then you'll get more bang for your buck if you do something in spring, summer than you will if you tried to do something new like this in winter. Anyway, all right, thanks everyone. Have a great rest of the evening or day if you're in the UK and you're having a day, and some people are might have been the middle of the night, early in the morning for you in the US. So all right, take it easy, and next week will be Wednesday night for the US time, and Thursday morning in Australia. Okay.